Hello everyone and welcome to my channel. If you're new here, my name is Dr. Nigel and I am a GMC registered medical practitioner from India. I recently gave my PLAB 2 exam in Jan of 2021 after a whole long delay because of COVID, and I thought I'd make this video so I could make the whole PLAB 2 process a lot more smooth and transparent for anybody watching this video. This is the first part in a video series about PLAB 2, and in this video we'll be talking about just the introduction to PLAB 2, the absolute basics of the exam, for those of you who have already started preparing for the exam and have some idea of what to expect. I hope this video will still be useful to you because I will be speaking about my personal exam experiences. Of course, I won't be talking about the exact scenarios that we'll see in the exam because that's not allowed by GMC, but what I will be talking about is my approach to those stations and scenarios and how to deal with certain tricky situations that may arise in the exam as well. Okay, so let's just jump right into it everyone, and I hope you enjoyed this video. Okay, so let's get started. The PLAB 2 examination is the second part of the PLAB pathway for international medical graduates like myself to get GMC registration and a license to practice medicine in the UK. The exam covers everything a UK trained doctor could expect to see on their first day of Foundation Year 2 training. It is a clinically oriented OSCE exam. Now, many of you will be familiar with OSCE examinations, but the thing to remember about this exam is the approach is going to be completely different from the one you are used to in your home country. The exam takes place only in Manchester in the UK as of now, and it has two sessions. For example, if you were to go to the exam, you may get either the morning session, which starts roughly around 10 o'clock in the morning, or the afternoon session, which could start anywhere from 1 to 3 p.m. One important point to note about this is that since you've already passed your PLAB 1 examination, they assume you already have the theoretical knowledge required to work at an FY2 level in the UK. So this exam is not about showing your theoretical knowledge, but it's their way of seeing how you would act and interact with patients in a clinical setting in the UK. Each exam in the current setup has 16 stations and 2 rest stations for a total of 18 stations. Each station goes for about 8 minutes, but it feels a lot longer than that sometimes depending on how tough it is. You get about a minute and a half in between these stations, and it's not rest time unfortunately. That's the time where you really have to think and prepare for the next station or scenario. So those 1.5 minutes, those 90 seconds are arguably as important as the 8 minutes you spend in the scenario talking to the simulator or the patient. The total time of the exam is roughly about 3 hours. I think exactly it's 2 hours and 50 minutes. Yeah, it does feel like it's going to be a very long time, but you know, the moment you step into the exam, you'll feel like just 5 minutes have passed by when you walk out. Many people tend to be very worried about what to expect in the exam and what sort of clinical scenarios they can expect to see, but I just want to reassure you guys that since the exam is testing doctors at just an FY2 level, you wouldn't be expecting to see anything that's too out of the ordinary. In most cases, these will be situations and conditions that you have already dealt with in medical school and probably in your internship or work back home. Okay, so the patients in this exam, they're all just actors, they're paid simulators, but honestly, I think they do a fantastic job of it. They're very realistic, so I think you guys should keep that in mind, that you're not dealing with real patients. These actors and simulators are just so talented that you will feel like you're speaking to a real patient. Another thing I would like to point out regarding that is this is your opportunity to sort of prepare for NHS work life. I know many of you are going to be really anxious and frustrated about giving this exam because, you know, it's a lot of money to spend and you're going to be spending a lot of time and traveling, and you may have to take time off work as well. Because these simulators are so talented and they behave just like real patients do in the UK, you will sort of get an idea of how to interact with people over there, how to interact and speak and approach patients in the NHS. So, if you think about this exam as an opportunity to prepare for your NHS work life, it can become a much more simpler and smoother process for you rather than a very anxious and stressful one, because you'll just be thinking about not passing rather than how this could help you prepare for your NHS work life. As I mentioned, this is actually a very expensive exam, not even including the cost of travel and accommodation and all the time spent, but the exam itself is about £879 as of the 1st of May 2021. So since it's such an expensive exam, it's very important to prepare well, know how to prepare, and give your best on the exam day too. Okay, so that was just the general outline of the PLAB 2 exam, and I hope that gave you some idea of what the exam is going to be like and the costs and everything and where the exam is going to be. The other thing I want to talk about is the marking criteria, so how you can expect them to mark you in the exam. Each station, each of those 16 stations that you will see in the exam, each of them is out of 12 marks, and those 12 marks are divided into 3 domains, which you will have to keep in your mind while practicing and while in the exam too. The first domain is data gathering, technical and assessment skills. Now those count for 4 marks, and what that means is they will be looking at your history taking skills, your examination skills, your knowing which investigations would be required for certain patients and conditions, and the knowledge of what sort of procedures would be able to help that patient in that scenario. The second domain, which is also for 4 marks, is the clinical management skills domain. In this domain, they will be looking for how you manage and approach the patient, how you approach their condition, and how you establish rapport and make sure that the patient is able to understand the information you are trying to communicate to them. Apart from that, they're also going to be looking at certain aspects like whether you're able to recognize red flag signs, whether you're able to adequately safety net a patient. Now, this safety net phrase, what that means is whether you're able to give patient information so that they would be able to recognize their own signs and symptoms and come back to the hospital or contact the emergency services if required. So for example, if somebody comes to you with chest pain, you would safety net them by telling them that they should definitely, contact the hospital or contact emergency services if they feel severe chest pain, if it's radiating to their arm or neck and jaw, if they start sweating, and if they start feeling breathlessness, because as we know, these are all signs of an MI or a heart attack. So if you adequately safety net a patient, they will know when to contact the emergency services. So just these are some things they'll be looking for in the clinical management domain. The third domain is more of a passive domain, but it is also extremely important. It's also out of 4 marks, and it is the interpersonal skills domain. In the interpersonal skills domain, they're looking to see your approach to the station. They want to know exactly how you establish rapport with the patient. They're going to look at your ethical skills, your professionalism, how you make the patient understand what you're trying to say, and whether you understand what the patient is trying to tell you. They'll try to see whether you're able to manage the patient's concerns adequately apart from the patient's medical condition, and they will also try and see your reactions to various medical scenarios, especially difficult situations or ethical situations, things like that. So interpersonal skills, it may be more of a passive domain, but it is by no means an unimportant one. In fact, I think it is one of the most important things you can work on in the exam, since for me personally, I feel interpersonal skills were what got me through the exam, and if I was not able to perform so well in that domain, I may not even have passed the exam. Now moving on to the exact way they will be marking you in the exam. So the scoring method they use is called the borderline regression scoring method. That may be a bit confusing, but let me assure you it's quite simple. What that means is the pass mark is based on the difficulty of that station and also how other candidates have performed on that day. So for example, suppose many people have performed very well on that day, they may increase the pass mark required for that day because so many people have performed well. If many people have not performed very well on that day, or the stations were quite difficult, they may lower the pass mark required, which might make it slightly easier for people to pass on that difficult exam day. So the two things you need to keep in mind when trying to pass the exam are, you have to try and pass more than the required number of stations. So for example, in the current setup, there are 16 stations, but you only need to pass 10 stations out of that to pass the exam. The other thing they mark you on is the total pass mark of the day. So Currently, the total marks that you can possibly get is 192. But for example, you may only need 110 marks to pass on that specific exam day, depending on how difficult the exam was and depending on how the other candidates have performed. For example, if you were able to pass those 10 stations, suppose you even got 11 or 12 stations and you passed those, and you were not able to secure that 110 mark out of 192. So if you passed 10 stations but you only got 109, you would still not be able to pass the exam. You need to get more than those 10 stations, and you would also need to get above 110 marks in that specific scenario. Alright, so here I've attached a sample marking scheme for the PLAB 2 examination. I've just gotten this from online, and what I wanted to show you guys was how you can pass, fail certain stations but still manage to pass overall in the exam. So for example, we can see the three domains that we had discussed before over here: the data gathering, the clinical management, and interpersonal skills. So as I said, they're all marked equally. You can get 4 marks in data gathering, you can get 4 marks in clinical management, and you can get 4 marks in interpersonal skills. Let's take this first station for example. In this first station, this person has gotten 4 marks out of 4 in data gathering. They have gotten 1 mark out of 4 in clinical management, and they have gotten 4 marks in interpersonal skills, for a total of 9 marks in this station. They only needed 7.98 marks to pass this station, which means they did indeed pass the station. For example, a station which this person has failed, we can take station 3. So this person has gotten 4 marks in data gathering, 0 in clinical management, and 2 marks in interpersonal skills, for a total of 6 marks, where they needed 8.12 marks to pass that station, which means they ended up failing this station. So guys, I hope this sort of gives you an idea of how important each of these domains is, because if this person had just scored maybe 2 or 3 more marks in management, or maybe 1 more mark in interpersonal skills that way, they could have ended up passing this station. But the thing to keep in mind is that even if a station doesn't go well, that's still not the end of the world for you. It's not the end of the line, because you're allowed to at least fail 6 stations, but you also need to get above that total pass mark too. Looking at this person's total score, they've gotten 134 marks, and they only needed 133.45 to pass the exam. So in the end, this person has ended up passing the exam by a margin of just 0.55 marks. So that's how important it is to give your all in every single station, guys, because you never know whether you're gonna pass or fail by just 1 mark. So please keep that in mind too. So I hope that's given you guys some sort of an idea of how important it is to give your all in every single possible exam scenario, because you never know whether you're going to pass or fail by just a 0.1 mark margin. So keep that in mind, guys. Even if a station doesn't go well, still give it your all, give it your best, and try not to think about it in future stations so it won't affect how those other stations go. So apart from data gathering, clinical management, and interpersonal skills, they are also going to be looking for 10 specific domains in each and every candidate. So let's have a look at those. Alright, so as you guys can see, they will be marking you on 10 of these clinical domains, and unfortunately the funny thing is they have put these ticks over here, but unfortunately in this exam ticks are not a good thing, they're a bad thing. So for example, let's take this first station over here. This person has gotten a tick in consultation, and they've gotten a tick in listening. And what this means is that the examiner has found that this candidate was not able to demonstrate adequate consultation skills and adequate listening skills. But despite getting a couple of ticks here and there, you may still be able to pass a station. So you don't need to worry too much about that, but you do need to keep in mind these specific domains, because this is sort of what they will be marking you on in each and every station. Alright, so now let's talk about the actual PLAB 2 stations themselves. So this exam has hundreds of different types of stations and scenarios, and at first it can seem really scary to have to prepare for so many types of scenarios. But the good thing is most of these scenarios can be divided into specific categories. So for example, you could have history taking or counseling scenarios, ethical scenarios, examination, procedure stations, things like that. And these can be further subdivided into different topics like cardiology, respiratory medicine, neurology, etc. Once you have in mind that all of these hundreds of scenarios can just be lumped in together. Rather than studying for individual hundreds of stations, you will just have to learn the approach to a certain type of station. So, for example, if somebody comes to you with chest pain, you would just need to know how to tackle a cardiology or a chest pain sort of case, and you will have an idea of what sort of questions you need to ask. You would have an idea of what sort of complications you need to keep in mind, some differentials you need to rule out, and what examinations and investigations would be important in a person coming to you with chest pain. So that's just an example I'm using, but once you start studying with that mindset, you can apply this to any category of station, and it's going to make your studying process a whole lot easier. Even in the worst case scenario, if you have no idea what the station is going to be, or if you're just very confused on how to tackle the station, the thing to keep in mind is that they, above all else, they're looking for you to be a safe doctor. Now, this is a phrase that's going to come up throughout your preparation process, throughout the examination, and it's also going to come up when you're working in the NHS. Now, what that means is, at the very least, when a patient comes to you, you are expected to give them the information that will keep them safe and make sure that nothing bad happens to them after they leave you. Now, how you would go about doing this, I will give you an example. So if somebody were to come to you with neck stiffness and photophobia and a rash, then being a safe doctor would mean recognizing that these could be red flag signs for something more serious like meningitis. You would be able to get the relevant history out of the patient, ask for the correct examinations and investigations, know what treatment would be required to start out, and then refer them and notify about the disease and that sort of thing. So I'm just talking very broadly over here. I'm not going to go into the details of what to do if someone has meningitis or anything like that, but just to keep in mind that in any sort of case, if something like this arises, you should be able to spot the issue that could arise, and you should take steps to prevent something bad or worse from happening to this patient. That's, in a general sense, that's what it means to be a safe doctor in the UK. And if you're completely lost, just use that as a guideline, that you need to be a safe doctor and take decisions with that in mind. Alright guys, so that's the end of this video on an introduction to PLAB 2. So if you guys found this video useful, then give it a big thumbs up and subscribe to this channel too, so you can keep up with future updates and resources. If you guys have any ideas on future videos or any topics that you'd like me to discuss, then please leave a comment below. Alright, so we have come to the end of this video. I hope you guys found it useful. I hope all of you guys and your families are keeping safe during this pandemic. I know it's a really difficult time for everybody, and with a little bit of luck and determination, I know all of you are going to get through this exam. So good luck to everyone, and goodbye.